Welcome to the Invermere and District Hospital here in the heart of the Columbia Valley. Our hospital is here to serve families from Invermere and the many communities in the valley, including the Shuswap and Akiskayuk First Nations. We've created this virtual tour to show families our labor and delivery facilities, and we hope to answer some of the questions that you may have as you are planning the birth of your baby. Hi there, I'm Joanne Gillis, and I'm a registered midwife here in Invermere. Despite our remote location, we're very lucky to have an amazing team of skilled care providers and nurses here in our community. Although we work in 3 different practices, we often support each other on call, and there may be times when you meet one of the other care providers during a pregnancy assessment at the hospital. During our tour, you'll see just a few of our many nurses who are trained in maternity care. We have an amazing team that are here 24 hours a day and are ready to take care of you. Having a healthy and low-risk pregnancy is ideal if you're planning to deliver here, but we're also equipped to deal with emergencies and unexpected deliveries, because sometimes babies have other plans.
Hi, my name is Laura Thomas. I'm a registered nurse and patient care coordinator for the Invermere Hospital. I'd like to welcome you to our facility, and I will be going through a step-by-step tour of what to expect if you come to our hospital in labor, as well as a nice tour of our labor and delivery room. We will offer some suggestions about how to make your stay here as comfortable as possible and hopefully answer questions about having your baby at our facility. Now let's go inside. Once inside, you're going to want to head over to this button over here. It's the triage button. You're going to press the button. The triage nurse will come and greet you, tell them you're in labor, and we'll bring you to the labor and delivery room. Come follow me. You're going to pass by the nursing station. And come into the labor and delivery room from here. Welcome, this is our labor and delivery room. This is where you'll be staying until the birth of your baby. We want this space to feel safe and familiar, which means you could bring in any of your personal belongings, such as your own personal pillow, maybe some LED candles, some essential oils, maybe a speaker if you have a baby birthing playlist that you'd like to be played while you're here. We also welcome bringing in any snacks or foods for you and your support person. You're also welcome to bring in any of your own personal clothes or PJs that will keep you comfortable during your stay, and don't forget your phone charger. During labor, your nurse or care provider may provide you with many different comfort strategies to help get you through the labor process. You do start out in the bed, which has many different adjustment abilities to help support you in all the different stages of labor. But we do have other equipment such as the peanut ball, the birthing ball, as well as our shower if you like to move around in your space. As we do not have epidurals at our site, we do still have options for our maternity patients. That may be nitrous oxide, otherwise known as laughing gas, as well as morphine and fentanyl if you find you need it during labor. So we are a smaller hospital, but we do have all the necessary equipment to make sure that you and baby are safe during labor. We will initially start off using a Doppler ultrasound. If we see any sort of concerns during that initial stage of monitoring, we do have the ability to hook you up to an electric fetal monitor. This monitor helps us watch you and baby more closely and is also used during non-stress tests in case you need to come in for that before you go into labor. We support skin-to-skin post-delivery here at IDH. However, if we have any concerns about the babe, we do have a panda warmer that we can use to help support postpartum care when need be. All of our staff here are trained and certified to provide the necessary care for your baby in the postpartum phase. We realize that for some people, having their baby, it can be very important to have family supports nearby. Whenever we are able, we provide family and visitor areas for loved ones to be nearby to support and celebrate with you as your baby arrives. After you and your baby have had time to snuggle and recover from the birth, we will help you move to a private room for your postpartum stay. There's a fold-out bed for your support person, and the hospital provides the essential things you will need while you're here, such as newborn diapers, baby blankets, a breastfeeding pillow and breast pump, and postpartum pads for mom. In the first days after your birth, we will help ensure that you and your baby are recovering well, and we will offer as much support as you need to get your baby feeding well and to help you feel confident before you head home.
Once you've arrived home with your baby, you'll be contacted by one of our public health nurses to check in and see how you're doing. The public health nurses will be able to answer nearly all of your new parent questions, discuss newborn immunizations, and support you as a new parent. Both the public health nurses and the midwives are available to provide you additional support and home visits if you're struggling with breastfeeding issues or other infant concerns. Please don't hesitate to reach out to us. We hope this tour has given you an idea of what it's like to give birth here locally in our hospital. And we'd encourage you to ask your doctor or midwife any other questions you have and to discuss where the best place is for your specific delivery. On behalf of the whole team here at Invermere District Hospital, whether you're having your first baby or your fourth, we are ready for you and we're excited to see you soon.